Welcome to Psychiatric Mental Health Nursing, a vital area of healthcare practice. Today, we will explore mental health, theories, therapeutic relationships, and recovery. We aim to distinguish mental health from illness and understand wellness dimensions. Mental health is a state of well-being, enabling coping and community contribution. The mentally healthy individual, A, strives to achieve balance in physical, emotional, social, and spiritual spheres, and B, is able to cope effectively with normal stresses in life and function productively to meet individual, family, and community needs. Balancing these 8 dimensions is crucial for holistic well-being. Wellness is being in good physical and mental health, is not the absence of disease. Mental health is the emotional and psychological well-being of an individual who has the capacity to interact with others, deal with ordinary stress, perceive one's surroundings realistically. Mental health exists on a continuum from well-being to severe illness. A mental disorder is a diagnosable disorder that affects a person's thinking, emotional state, and behavior, disrupts the person's ability to work, carry out daily activities, engage in satisfying relationships. A mental health challenge significantly impacts thinking, feeling, or acting. Consider if mental health is essential for overall health. Stigma creates negative attitudes, leading to discrimination and hindering help-seeking. 3 types are experienced. Public stigma involves negative societal beliefs about mental illness, such as stereotypes that individuals are dangerous, unpredictable, or unable to function independently. These attitudes are often reinforced by media and can lead to blame, judgment, and the use of stigmatizing language. Self-stigma occurs when individuals internalize these negative beliefs, begin to see themselves through a stigmatizing lens, and experience decreased self-esteem and confidence. Label avoidance refers to avoiding mental health treatment or support out of fear of being labeled or judged. Theoretical frameworks provide essential tools for understanding human behavior. Maslow's hierarchy outlines fundamental human needs from basic to self-actualization. This theory emphasizes patient strengths and prioritizes nursing actions effectively. Freud introduced the id, ego, and superego, shaping personality development. Freud's work highlights unconscious influences and the importance of listening. Transference occurs when a patient unconsciously redirects feelings, expectations, or emotional responses from past significant relationships onto the nurse. For example, a patient who experienced abandonment may view the nurse as rejecting or uncaring if the nurse sets limits or cannot spend extra time with them, even though the nurse's behavior is appropriate and professional. Countertransference occurs when the nurse develops an emotional response to the patient based on the nurse's own past experiences, values, or unmet needs. For instance, a nurse may feel overly protective of a patient who reminds them of a family member, or become unusually frustrated with a patient whose behaviors trigger personal discomfort. Recognizing transference and countertransference is essential in mental health nursing, as unaddressed emotional reactions can interfere with therapeutic boundaries and clinical judgment. Personality develops across the lifespan, with opportunities for growth at each stage. Assessing a patient's stage of development using Erikson's framework helps nurses understand the core psychosocial task the patient may be struggling with, such as intimacy versus isolation, or integrity versus despair. By recognizing these challenges, nurses can use therapeutic communication, support, and meaningful connection to help patients navigate conflict and move toward healthier resolution. Erikson's model guides nursing assessment and informs effective interventions. Many theorists, like Peplau, have shaped psychiatric nursing practice. As you review these nursing theories, consider which framework resonates most with your values, beliefs, and approach to patient care. Hildegard Peplau is a pioneer in psychiatric nursing, focusing on interpersonal relations. Hildegard Peplau's theory resonates strongly with my practice of nursing because it honors the mutual nature of the therapeutic relationship, recognizing that both the patient and the nurse are shaped through connection, reflection, and growth. Peplau emphasized empathy, mutuality, and unconditional acceptance in nursing. The focus is on empowering patients to help themselves, fostering autonomy. The function of nursing is to promote adaptation by assisting client to use their strengths in modifying internal and external environments. Nursing roles focus on exploring nursing actions and the importance of improving patients' autonomy and maturity. Nurses engage in diverse roles, from prevention to crisis intervention. Nursing actions aim to increase coping, self-care, and medication adherence. Self-awareness is vital for nurses to establish therapeutic relationships effectively. Reflective learning helps you make sense of your nursing experiences by thinking about what happened, how you felt, and what you did. When your thoughts, emotions, and actions come together through reflection, you gain insight that helps you grow as a nurse and improve your practice. Through retrospective critical thinking, you learn by looking back on experiences, recognizing patterns, and identifying what you would keep or change next time. Reflection on action happens after an experience, while reflection in action allows you to adjust and respond thoughtfully in the moment, helping you remain present, flexible, and therapeutic in patient care. Nurses develop intuitive knowing, which reflection helps articulate into words. Therapeutic communication involves active listening and assertive techniques. The nurse-patient relationship progresses through orientation, working, and termination phases. Before meeting the patient, the nurse begins the pre-orientation phase by reflecting on personal thoughts, feelings, and potential biases. This self-awareness helps prevent assumptions, counter-transference, and boundary issues, allowing the nurse to enter the relationship grounded, open, and therapeutic. The orientation phase establishes rapport, sets parameters, and defines confidentiality. During the working phase, nurses promote problem-solving and facilitate behavioral change. The termination phase summarizes achievements and reviews coping strategies. Consider the initial steps in building a therapeutic connection. Which activity occurs during the orientation phase of the nurse-patient relationship? A. Testing the relationship. B. Resolving the problem. C. Engaging in problem-solving. D. Identifying problems. Think about how nurses build trust with patients. A nurse seeks to establish a relationship with a patient readmitted to the hospital. The patient has bipolar disorder, depressed type, and was hospitalized the preceding month. Which statement by the nurse would contribute to establishing trust? A. Weren't you complying with your medication regimen? B. It must be discouraging to be readmitted to the hospital so soon. C. Everyone with bipolar disorder ends up in the hospital occasionally. D. You must take your drugs as prescribed or you will be rehospitalized. Reflect on how personal feelings can impact professional interactions. A nurse spends extra time with a client who has personality features similar to the nurse's estranged spouse. Which aspect of countertransference is most likely to result? A. Over-involvement. B. Misuse of honesty. C. Indifference. D. Rescue. Consider the ethical implications of accepting gifts from patients. A client preparing for discharge presents the nurse with a handmade card of appreciation for the care this nurse provided. Should the nurse accept the card? A. Yes. B. No. C. Not sure. Recovery-oriented care empowers individuals to manage illness and build resilience. Recovery-oriented care focuses on hope, strengths, and the belief that individuals can live meaningful lives beyond their diagnosis. Recovery is supported through respectful partnerships, shared decision-making, and empowering patients with the skills and supports needed to move toward their personal goals. Recovery is supported by health, home, purpose, and community connections. Nurses play a key role by fostering hope, honoring patient goals, reducing stigma, and empowering individuals to build skills, resilience, and a sense of control over their own recovery journey. Let's discuss how these concepts apply to your practice and patient care. Share creative ways you've met the learning outcomes. Discuss mental health versus mental health challenges and mental illness. Describe how the theoretical concepts can be used in the assessment of patients and in our nursing practice. Thank you for your engagement and commitment to psychiatric mental health nursing.